From my personal experience, one area in which caregivers may tread on our dignity and autonomy when helping us to adhere to a treatment plan is sometimes they make decisions on our behalf instead of involving us. I mean, by my experience, like sometimes they assume what is best for you without asking you, and it felt really disempowering to me. So I wish they included me in that conversation. I think patients they should have the main voice in the treatment plan because ultimately they are the ones who are using it and they are the ones whose lives are at stake. I find it sometimes quite frustrating when caregivers or doctors think they know what is best for us, but they don't have first-hand experience of being on the treatment. And sometimes a lot of like medical gaslighting can take place. So I would say patients need to have their say in the treatment timing and approach whenever possible, and to frame these choices as collaborative rather than individualized. So what I mean by this is like patients, caregivers, medical professionals, they all work as a team, and each individual team member has a stake, an equal stake in the conversation. So it's important to have that equity in any healthcare discussion, especially relating to treatment plans. The other thing is like for caregivers, in my experience, especially parents, my own parents, sometimes they can over remind, they can nag me sometimes that I feel like I know what I'm doing, I'm in charge, and they shouldn't worry too much about how I deal with my own body. I think ultimately for us adults, once we reach an adult age, I think our health is in our hands and doesn't really help to have people nagging at us or overstepping the boundary and sometimes that can feel very suffocating. So I would say it's good to have structured check-in times now. What you will have with an accountability partner instead of checking in like every hour or every minute. I think sometimes we need to trust the patients also know what they're doing, and they have the autonomy and also the independence to decide how they want to adhere to their treatment plan. The last thing is also know how to ask the right questions. So like saying the patient is not doing enough for their treatment plan or things like that. I think what will be better is to look at it in a more collaborative approach. And how can we do better? How can we make this work better? And it's important also not to ignore the emotions of the patient because it's never easy to having the stress of trying to recall what steps or what treatments they need to take. Because for rare disease patients, it can really be a whole list. So I think we need more patience and understanding. And sometimes we don't deliberately forget this. More because we're overwhelmed by the sheer amount of treatments we are on. So what I would say is that it's important to also bring ourselves to the level of the patient and understand their position as well when we are giving care to others, and that way we can also work towards supporting the well-being of the patient, which is ultimately to me what matters the most.